Good evening, everybody. Welcome again to our Friday, the time we meet together on Fridays. Today is 28th. It's a very interesting day today. It's supposed to be the women's menstrual day. Uh, I think it's only men who menstruate. I mean, women who menstruate. So it's Women's Menstrual Day, and it's also Women's Day, and it's also a mental health month. So there is a lot that's going on. So welcome this Friday of 28th of May, 2021. Um, we usually meet on Fridays to give a bit of knowledge to some people who uh, need it. We all need knowledge. There's none of us who has enough. So we give what we can and we receive from others what they give us. So here we are. We talk from a platform called She Chooses to Live Initiative. It is an NGO that seeks to give people knowledge, and especially knowledge on health matters, so that people are able to make choices that are informed, and then they choose to live either a full life or a healthy life. So that's what we are at. We come from She Chooses to Live Initiative, and we've tackled various topics that people have sent us to tackle, and you are all welcome to send some others. Uh, what you feel you would want elaborated or enlarged, we would want to talk about on this platform. Now, to introduce myself today, my tech guy has decided to be a bit busy. She is actually quite occupied. So I'm sitting here alone. So if you find technical issues, just forgive, because I'm not a technician. I'm a talker. So today we are, like I said, I'm Dr. Jane Wakahe, coming from She Chooses to Live Initiative. And today we are talking about a certain topic. The topic we are having today is called female hygiene. Um, I will. It's a kind of difficult topic to present, because there is no flow to it. So you'll hear a lot of do's and a lot of don'ts. I may not be able to explain every one of the do's or don'ts about the hygiene, and maybe the way we would elaborate more is if there are questions on the topic. So we'll talk about female hygiene this evening, and what is hygiene is the question. And hygiene is conditions or and practices that help you to keep healthy, to maintain health, and to prevent disease. And this is both to yourself and to the environment at large. Uh, we don't need to be told a lot about hygiene in this COVID era, because we all know that we are having to wear masks, we are having to wash our hands very, very many times. That is to protect our own selves from getting COVID, and to protect other people from us giving them COVID. So the same thing applies where other areas are concerned, and the female genitalia is one of those areas that can be uh, infected, and we would be able to protect it against infection. So why is female genital hygiene important? And there are many reasons why. One, it lowers the risk of getting infections, getting diseases of all kinds of natures. It prevents any, if you keep yourself clean, it prevents the infectious material getting into yourself. It also allows one to look fresh and feel confident. And with that, it raises self-confidence. You can imagine if you are dirty pale pale and you are thinking you're smelling, how difficult it is to even appear in public. And it also prevents others. So it raises your self-esteem and it prevents others from being offended by yourself. So it's very important that we keep the female hygiene, because female hygiene is really, really key. Now, I've defined hygiene. We are calling it female hygiene. So the next thing that I would have defined is female, but I will not define female. What I will describe is the external female genitalia, because that's the area that hygiene is required. The internal genitalia is affected if the external means outside, the outside genitalia, the one we can see. If that is infected or it allows infection inside, then that can take infection right into the inside of the woman. So we are going to talk about to describe the external genitalia, and we'll start with the very, very important organ called the vagina, which is misunderstood by many people. The vagina is a hollow tube shaped actually like an H. It's not like a tunnel. It's not tubular. It's an H shape that comes all the way from the outside of the woman's body and goes right in to surround the cervix. The cervix is the opening of the uterus, the mouth of the womb. So the vagina runs all the way to from outside to host the cervix. The cervix kind of dips into the vagina, and when when sperm is deposited in there, then the cervix is able to pick it. The sperm is able to get into the cervix from the vagina because the sperm is deposited into the vagina. So there is at the top there, you can't see the top there, only I can see the top there. But where the cervix is, the vagina surrounds the cervix, and there is a lot of space around the cervix that is, shall we say, empty. The cervix is like the tip of a nose, or like my thumb. And so the vagina is a big thing with a little thumb poking inside. And at the back of the thumb, there's a lot of space called fornices. And if those areas are not nicely let out, then a lot of quite a bit of smell can come. Now, from the time a woman starts to menstruate, from the time we call menarche, to the time of menopause, then the vagina is a carrier of a discharge. There is always a discharge coming out of a woman's vagina in the time we call reproductive age. That discharge comes quite a bit of it from the cervix, from inside the uterus, from the cervix, and some from the vaginal wall. And then this discharge is allowed out through the vagina. The discharge it changes in consistency and in consistency and in amount as the period, the cycle, the menstrual cycle goes, so that at the time of bleeding and after bleeding and the time of ovulation is quite a different discharge at the time of ovulation as compared to immediately after periods or immediately after ovulation. So there is a cycle of a woman's discharge, and they are all normal. And having said that, a woman's discharge to be normal has to be color white and has to be not smelling bad. If it is smelling bad, or it's another color which is beyond color white, maybe color yellow, color brown, then it's not normal. And if it is itchy, if one feels itchy, if it makes the vagina sore, it's not normal. So an abnormal discharge you smell. Sometimes it's called the fishy smell. Sometimes it smells fermented. But every woman has a normal smell. There is there is a normal smell to that discharge, and it's not a foul smell, it's a woman smell. But if you ever feel your discharge is smelling a bit differently, then you need to uh, get yourself checked. Now, the other thing about the vagina is that it is very stretchable. It's stretchable lengthwise and it's stretchable widthwise, as uh, many of you who have delivered babies vaginally know that a whole baby's head and shoulders manage to come out through that tube called the vagina. So it's a very, very stretchable organ, especially in the reproductive age. When menopause hits, then it becomes a bit harder to stretch. And that's part of why there is that thing we discussed the other day called dyspareunia, the pain of having sex. So it's a stretchable H tube, and it's not smooth. It's got valleys and gullies and hills alongside itself. So it can hide quite a bit of discharge in between areas, which is not a bad thing. It's a lubricating thing, but if it is infected, then it becomes not a very, very nice something. Now, the vagina is kept acidic, completely acidic. It has a pH, a very high, a very low pH. It ranges between 3.8 to 4.5 pH. And if this must not change, if it changes, then things go way higher, haywire in the vagina. It has got bacteria, very good healthy bacteria called lactobacilli that live in the vagina, and they have a lot of use. Those bacteria, they they keep the vagina acidic. They are very good at that. They are also a big number, and there is power in numbers. So they are a very big number of bacteria. So any other bacteria trying to get in there will be overwhelmed by this number, which also makes acid, and which also in a little way makes something called bactericidal, something that can kill other bacteria. So the lactobacilli do also just that. They make some things called bacterocidicins that can kill some bacteria. And they also kind of coat the vagina to protect other bacteria and other harmful organisms from entering the vaginal wall. So the lactobacilli, I'm emphasizing about lactobacilli because they are very, very good, a very good protection that we have been given to protect our vaginas. And if anything changes and those lactobacilli disappear or they are not working very well, then we get into trouble in the vagina. So, so basics, lactobacilli must and should be in the vagina. Now, the other organ after describing the vagina is the labia. There are two sets of labia. There is labia minor, which means the smaller lips, and there is labia major, which means the bigger lips. Now, the smaller lips are inside the what are right next to the vagina, and at the top, at the upper part of them is what is the clitoris is found there. Now, between these two lips, between the small lips and the big lips, there is a big valley there, which we shall discuss about its cleaning because a lot of stuff can be held in there, and they can be very, very nasty stuff. Now, the labia major are again two lips, which are outside the uh, the small lips. So it's covered twice. The vagina is sort of covered by smaller lips and then by bigger lips on top of it. So it's a very important organ indeed. It's really guarded by those lips. But the bigger lips may have hair. They have part of the pubic hair is found there. Now let's talk about the pubic area. That's the area above the clitoris. The whole area that has hair is called the pubic area, and that is also part of the external genitalia of a woman that needs cleaning and keeping it hygienic. Then there is a very vital area called the perineum. Now, this is a very, very important area. It's the area that is between the vagina and the anus. That is called the perineum. And that area will need a lot of cleaning. For people who have delivered, that's the area that stretches, and sometimes we cut there for there's something called episiotomy to let a baby out through there. So that is what is the perineum, between the vagina and the anus behind. That is an area that can get very, very dirty. Now, when a woman goes to the toilet, two things. If a woman, we tell people to wash hands after they leave the toilet, but a woman needs to wash her hands before she visits the toilet, then visits the toilet, and washes her hands after she visits the toilet. The reason is that there is so much stuff a woman can touch all over the place and introduce it either to her vagina or to her urethra as she is trying to do her things in the toilet. So where hands are concerned, you wash before, then you do your stuff, then you wash after. Now, as we teach young girls and we repeat it on older women, when you're wiping your stool, you wipe front backwards. You never bring it forwards to the vagina or to the urethra. The stool has a very interesting bacteria that lives in there called E. coli. And E. coli is a natural something in the stool. But if you bring it to the vagina, it will make literally the vagina smell like stool. And also the urethra, the commonest cause of urinary tract infection is E. coli. That is usually transmitted from one's anus towards the front. So one wipes from front backwards, throws that tissue away, and takes another fresh one and wipes from front backwards. That is the way to clean oneself. When one has not done the big poo and has just urinated, then one needs to dab their urethral outlet with tissue to make it dry, to keep it dry with clean tissue to keep it dry. We shall talk about underwear a little bit later. So that is when in poo. Now let's talk about cleaning that area. I have had a lot of stories about how you have to wash with water only and how you cannot use soap and such things and such things. The stuff that a woman produces down there is quite oily. If you are to wash with water only, you'll not get anywhere. You'll not be able to clean it enough. So please wash with soap and water. The only thing about the soap is that it has to be a very mild soap, not the harsh soap, not the medicated soaps, not the scented soaps, but mild soap. That if you don't wash with soap, then what happens is actually between the two lips, uh, the big lip and the small lip, they'll come. I usually describe it as what you see in dirty children around the neck. That oily fold something. Only in a woman it stinks. So do not let stuff accumulate between your labia, the bigger lip and the smaller lip. It can really stink all the way up to the clitoris. You've some of you have been to a toilet after another woman was there and the area was smelling. So clean with soap and water. It has to be mild soap and water. Do not clean. And then it needs that you clean at least once a day. You bathe that area, even if you're not bathing the whole body. You need to bathe that area nicely and properly at least once a day with soap, and make it clean and dry, and don't leave it wet. Now, important ones. Do not, and this is one of the major do nots. There will be many others, but this is the major do not. Do not clean inside the vagina at all. Do not poke a finger in there. Do not poke cotton. Do not poke water. Don't clean the vagina. The vagina self cleans itself. It doesn't need help from you. And in fact, if you try to clean inside the vagina, then what you do is that you change the acidity, you change the pH of the vaginal wall, and you remove the good bacteria, and you allow the bad bacteria to get in. So the first don't clean inside the vagina. Clean outside the whole of the genitalia area with soap and water, and make it clean everywhere. Please do not smell. Do not go smelling. It's a very, very nasty smell. Now let's talk about underwear. The, the vagina and the whole of the genitalia needs to breathe. So the underwear you wear needs to be able to let in air. So we are talking here about wearing things like especially cotton, because that will allow air to flow through. There should be nothing that is blocking air from getting into the vaginal area and into the genitalia. So avoid underwear that is will not let in air. Avoid tight underwear, because what tight underwear will do also for you, even if it is cotton, is that it will make somebody sweat in there, and there will be sweat, and the underwear will be wet, and bacteria will start to grow there and get their way into the vagina. So do not wear tight underwear. It should be material that should allow you to breathe, and the looseness should be that it should be allow you to breathe. Which then of course means those things are here that are called that go in between. I don't even remember their name. Those are not good things to wear at all. Now, keep underwear clean and dry. So, like I said, when you go to susu, when you go to pass urine, please dab your urethral area so that you don't keep the panty wet, because if it is wet, then it is going to let molds and to let bacteria grow in there. Use when you are using towels, try to use them as few times as you can. Now I know it's almost impossible to wash a towel every day unless you're in a hotel, but if you can, you should, and then you should dry them, sun dry your towels, and sun dry your underwear if you can. But the main thing is to let air go through the underwear so that there is no mold happening. Now, be alert. Be alert to changes in the discharge. Be alert in when checking yourself for the discharge. There is, like I said, you are not allowed to put a finger into the vagina. And there are times when you will think that your discharge is not the light, the white, or it's going a bit yellow. There is one time in your system when you are ovulating, then the discharge will come out like a thick something which looks like the white of an egg, or like some mucus one has blown. And when you almost sometimes feel it pop out of your vaginal system. And when it comes onto the panty and gets dry there, it goes yellowish and flaky. that yellow is allowed. The 2-3 days of ovulation mucus, you are allowed to have yellow. Otherwise, the discharge should be white and not not off white and not colored any other color but white, and it should be smelling good. So be alert about the changes in your discharge. So that's the one time you're allowed to have yellow discharge. And so why I was saying that is when you are deciding whether it's yellow or not, then you harvest it from just outside the vagina. If it has already been on the panty for some time and it's yellow, that may not mean yellow. But if you harvest it directly from just outside the vagina and then it is yellow, then that means it is yellow and it's not a healthy discharge. Now I'll start my list of do nots. So here is the list. The first one I already said is do not clean inside the vagina. It is self-cleaning. The second one is do not douche. Douche is there are a few times that a doctor might give you what is called a douche. And that is if there has been very persistent infection that will not be cleared easily. And only a doctor will give you a douche. And then that is actually very rare indeed. I don't ever remember telling anybody to use a douche in all my practice. So it's a very rare something. The douche is not a good thing. It's a chemical. They are chemicals. They change the pH of the vagina. They kill the lactobacilli, and you make yourself open to other bacteria invading the vagina and giving you what is called bacterial vaginosis. I think we've discussed that on another day. And bacterial vaginosis, believe you me, it smells. You sit and people smell. You smell like rotten fish, and you sit and people start to kind of walk away from you. So do not douche. That's the second don't. Now, the third don't is do not wipe with scented wipes. In fact, do not wipe with wipes, alcoholic wipes. Do not put there deodorant. Do not put powder. Do not put anything that is perfumed. Do not. You are not supposed to smell perfume there. You're supposed to smell woman there. And what these things do is they irritate the skin and they irritate the lips, and you can get yourself open to all kinds of infections and all kinds of allergies just because you used scented soap. So do not use anything scented down there. And that includes even scented pads. When you're having your period, do not use scented pads. Try to get pads that are plain, that are as plain as possible. I already said do not use harsh medicated soaps to clean down there. Do not use that. That's the other do not. Do not routinely wear panty liners. I see a lot of women who tell me they wear panty liners to try to keep their panties clean, and it is true. A woman's panty in between there where the discharge lands, it's very hard to keep clean because it like I said, the vagina is acidic, so that acid reacts with the material, and after a few months, then the panty is actually a different color in that particular spot. So a lot of women will wear panty liners to stop their panties going dirty. But what you're doing then is you're blocking your vagina from getting air, and you're changing the environment inside the vagina, which is not a good thing. So kindly, it is cheaper and safer to, if you're fed up with panties that are looking funny down there, to change them after a certain period of time. It's better than wearing panty liners. Now, the other do not is do not self-medicate. Even if you think you have a yeast infection, talk to your doctor. Do not self-medicate. You don't know what that discharge that you think is bad is. It could be many things. So kindly do not self-medicate yourself. Now there is another do not. I have been told that sometimes people are told to wear, I think they're called beads or something, into the vagina and to try to tighten the vagina wall. Do not, I repeat, do not. Do not put anything in the vagina. I keep saying in many forums, and I will repeat it here again, the only thing that is really allowed into the vagina is the penis. Other things are not, they are trespassing. Everything else is trespassing and should not be allowed. So kindly, those things that you are told that the beads you, I don't know, tighten you where, or some people will wash with, I'm told, with lemon water or something to keep tight. Please, there is a much easier way. They are more harmful than good. They can actually introduce all kinds of bad bacteria in there, which could finally even help to block your tubes, and you'll be unable to ever get a baby, or give you permanently what is called pelvic inflammatory disease, chronic pelvic inflammatory disease, just because you are trying to do some gymnastics in there. So do not. The other thing that I will say do not, and I know a lot of people you will want to disagree with me, is do not shave at all. Do not shave your pubic hair. Leave it there. Just clean it. It's actually quite protective in some ways, the pubic hair to the vaginal entry, and there is really no reason to shave it as long as you keep it clean. And if you must shave it, if it is becoming a nuisance, then take a pair of scissors and trim it, but do not shave. Do not shave. First of all, the shaving could cause those. I see a lot of girls and women with funny pimples, like the way men shave their beard and the way they get those pimples. Those pimples happen on the pubic area, and they can be quite infected, and they can have boils down there just because they shaved. All you need to do really is clean the pubic area and clean nicely. You do not need to shave. So do not shave. Now, so the main thing to remember is that every woman uh, has their own smell. And do not think that other people are smelling you when you're healthy. Now, there are times when you'll need a bit more cleaning than usual. If there is an infection coming out. So you might need to keep cleaning yourself many times, but please do it in a gentle manner. It's a very sensitive area. Even though you hear me say clean with soap, you can clean many times, but gently with soap and water, so that and keep changing your underwear very frequently. Definitely never wear an underwear 2 days, but even more than you can change several times in a day if you're feeling uncomfortable, and keep it clean. If a woman does not observe her hygiene, she has, again, I repeat, the most offensive smell that there is. So clean yourself. Now, during menses, if I may mention a little, today is Women's Menstrual Day. During menses, then one needs to be a bit more aggressive in cleaning. You should ideally at least bathe at least twice a day, and clean that area as often as you can when you are on periods. And like I said, do not overdo the panty liners. You can use the panty liners like the last day of the period, but thereafter, do not overdo panty liners. Now, I think I have said all the don'ts, and I've said the do is clean with soap and clean as often as you want, but clean gently, and make sure that your underwear is dry and clean, and if possible, sun dried. Now, I think I've given all about the hygiene, I believe. I imagine there will be some questions and some comments and some people who do not believe me, which is okay. But yeah, let me see if there are any questions or any comments. Today, like I said, my tech guy has gotten herself busy. So I'm here alone. I see no comment. I see no question. Seriously? Okay. Yeah. Uh, Sawa. No questions, no comments that I can see. And I think I'm looking where they usually come, where I was told they come. So I think there are no comments, there are no stories. Uh, if you feel shy to ask a question here, you can always ask her through Facebook or what. Uh, you can ask some way if you feel shy to to ask. Now about pubic hair, I've just seen a comment here. I ask this is a very common practice in girls who are 40 and below. In my generation, we didn't used to shave. Then in the girls 40 and below, I find they have shaved clean. So I kept asking, why do you shave? And believe you me, the commonest answer I get is that the man likes it that way. So my usual statement, my usual question is, does he shave himself? And they laugh, which I think is okay. Um, so there is no reason for a woman to shave. I even tell the others, the ones I talk to in the clinic, that these days we don't even shave women when they are giving birth. There's an area around the perineum below there where we shave, but the rest of the hair is left alone. So we don't shave. Um, and shaving can be quite. I hear some people even do what is called waxing. Do not just if you must if it is too long to a nuisance, just take scissors and trim. Okay, yeah, that's it. So I'll say bye bye because today I'm alone. Um, if like I said, you have my what is it WhatsApp or my Facebook or something, you can always ask those questions from there if you don't want to ask in public, so that I don't answer in public. Yeah. So I'm about to end this live video. So bye bye and have yourselves a lovely weekend. And please clean with soap and water. Keep clean. It helps prevent a lot of infections going in there. Bye.